Hello, I'm Alana Sloan with the East Texas Aging Disability Resource Center's Lifespan Respite Program. East Texas ADRC is a collaboration of local agencies assisting people in 14 counties. We strive to enhance your access to federal, state, and local services and supports. I'd like to introduce many of the individuals who represent East Texas agencies that assist the elderly, those with special needs and disabilities, and even their caregivers. These agencies are doing incredible jobs improving quality of life through various services and resources such as support groups, respite care, home repair, and transportation, and so much more. Talking with our local authorities from Community Health Corps, Andrews Center, and Access, I saw how they strive to help, assist, and provide for those with mental health and intellectual developmental disabilities. This was a very informative discussion. I just want to thank everybody for being here today. So let's just kind of start this out. Take the moment to introduce yourself, and Donna will let you take the lead.
I'm Donna Daigle. I work for Access, the local authority for Anderson and Cherokee County.
I'm April Lanier. I'm the local authority IDD director for Andrews Center.
I'm Sandra Taylor, and I'm the IDD, which is Intellectual Developmental Disabilities Director for Community Health Corps.
That's great. How did each of you find yourself working for those agencies?
I started working for Access about 6 years ago. I have a family member with disabilities, so it's always been in my heart to help others.
Mm-hmm.
I started working for Andrews Center 8 years ago. I moved here from Louisiana. Back home, my mother has worked for Shriners Hospital for Children my entire life, and they work with special needs individuals, and I have family members with special needs, and so that kind of brought me to the Andrews Center.
The prior job that I had, Community Health Corps was one of our partners. So I was always interested in the work that they were doing, and in addition, I have a sister who has intellectual developmental disabilities. So when the opportunity arrived about 6 years ago for me to work for Community Health Corps, I was just very, very excited to have this opportunity.
You can call our local number. It's 903-586-9000. As for Carla Sanders, she's our intake and our programs officer.
We also have a 1-800 number, and it's 1-800-4-INTAKE intake. And that would actually start the process for them actually coming to our facility, and we would start the intake process on them.
Well, at the Andrews Center, we have an intake coordinator that they can contact by calling our main center in Tyler. It's 903-597-1351. Or they can contact the IDD department and ask for myself. My phone number is 903-597-5067. We also have an Andrews Center website that's just been updated. The web link is www.andrewscenter.com, and it's also user-friendly for smartphones. And it has all of our contact information there for someone to call for intake services.
That's good to know. Thank you. How do you define respite?
Well, I would define it as a rest or a break for the caregiver of an individual with developmental disability.
Now, why do you believe it's so important to have that break?
Well, that caregiver is probably spending almost all their time providing assistance to that individual with developmental disability. And they need a break. Even if it's just for a couple of hours, just to go and do whatever they want to do, because they're spending so much of their time with their loved one. And even the loved one would appreciate the time apart from the caregiver.
What resources or services do you offer for caregivers to have that break?
We offer a summer respite. It's for children, and it's basically Monday through Friday, 8 a.m. to 3 p.m. And this respite program provides daily living skills and other opportunities. We also provide a weekend respite for Cherokee County from the same hours, and it's for Saturday.
April?
Well, at the Andrews Center, we offer about 20 hours of respite services a month through our general revenue services. We also work with Trinity Mother Francis Special Needs Clinic. They offer a once a month Saturday respite program. It is located at our facility, and so this is where parents can drop their children off and they have their daily living skills, training for some of the individuals. Sometimes it's just basically a respite, a break.
Community Health Corps offers some of the same services as Access and also as Andrew Center. Just like Andrew Centers, we offer general revenue respite, and that's anywhere between 10, 15, 20 hours a month for the caregivers. We also are working with ADRC, Aging and Disability Resource Services. They have a lifespan respite grant, and I think that can be some additional hours for the caregivers on top of what's being offered with our general revenue funds.
So just to wrap things up, if you could say one thing to caregivers in relation to your services, what would that be?
Call for help.
I definitely agree. Don't be afraid to call and ask for help.
There's opportunities for everyone to receive some time away and get the help you need.
So if you're watching this video, call.
Yes.
Yeah, call.
Well, thank you so much. I just want to thank you again for taking the time to just tell everybody about the wonderful things you are doing for IDD, mental health. It is a great pleasure to talk to all of you.
Thank you.
Thank you.
Thank you.